several hospitals within the central Washington region, Yakima, of course, being the most hardest hit, have had a sudden increase in COVID cases. It's been particularly challenging with critical care patients who are quite ill, and Yakima Memorial has significantly expanded their ICU, but as more people get sick, they are having to transfer essentially all of those patients out of their hospital, and also the area hospitals in central Washington and that region are also having challenges. People who are working in those hospitals are also part of the community, are also getting sick at the same time. And so they are both having a significant rise in a number of cases presenting to the hospital, but also challenges with providing the staff that they need to take care of these patients at the same time as their own community of caregivers get sick as well. At the very beginning of this pandemic, we recognizing that coordination was going to be a significant need, we have stood up an operation in our role within the community as disaster coordinators, and we applied it to COVID. Our goal in the Regional COVID Coordination Center is to look all over Western Washington and into Central Washington, even the entire state, and say, where are the facilities that can care for these patients and distribute them to where the patients who are sick get the care that they need, and any one hospital or system is not overburdened, because then you have to worry about those patients not getting the care that they need. Right now, we focus a lot of our attention on Yakima, but we've also been working with area long-term care facilities as they have outbreaks and distributing patients equitably and openly throughout Western Washington in order to, again, make sure any one of our systems is not overwhelmed with these patients who need a lot of care. The biggest risk for people who are going to be infected is really in the community. It's going to the grocery store. It's getting together with family members that you haven't seen in a while. It is getting together with friends and doing all the things that we want and desire to do as people, which is very understandable. But the risks are still present and they have not gone away. We are seeing a significant increase in younger people in the 20 and 30-year-old type of, the 20 or 30-year-old part of our community. And even if they think to themselves that they are probably not going to get very sick from the disease, it'll be something minor, they may not even experience symptoms, they are putting other people at risk. In order for all of us to stay safe as a community, we have to maintain all the recommendations that we are familiar with. Wearing a mask. I'm going to put a mask on as soon as we are done. Washing our hands, staying 6 feet away, and maintaining that distancing, which we know is so important.